early detection for us is actually very beneficial because, when you have radiation, it kind of makes our reconstruction more difficult. So, everyone always talks about early detection, but tell us what do you mean by early detection, and when should a woman start doing mammograms?
So I think before the mammograms, I think women should be aware of their whole body, not just their breasts, so that they know if there's any changes. Because a lot of times it's a woman who finds it. It's not necessarily something that we would pick up. But when we come to actually screening, there's so much controversy because so many different groups around the world have different guidelines as to when to start doing mammograms. So mammograms are basically x-rays of the breasts. And when we say screening, we mean that you're absolutely fine and we're just going to take a picture of your breasts so that if there is anything starting, we will find it before you find it. And in some countries, they start at 40, some countries they start at 45, some countries at 50. And some countries do it every year, some countries every 2 years, and some every 3 years. So, and of course, a lot of these guidelines are based on the pattern of breast cancer in these countries. In this part of the world, of course, we see breast cancer much younger. So it's always a difficult to extrapolate those guidelines to this part of the world. Personally, as a specialist, I tend to individualize my screenings. So, saying somebody should start at 45 or 50 is a bit random, but for my patients, I look at different things. So what do their breasts look like on a mammogram? If you've got dense breasts, dense means the breast tissue is relatively thick compared to the rest of the breast, which is usually fat, the x-rays don't penetrate it so well. And that in itself is an independent risk factor for breast cancer. I look at family history. I think family history is important. I look at whether we need to do a genetic test. I look at how busy your breasts are in terms of how often we need to check. But generally, I think having your first one at 40, if you're absolutely fine, don't have a family history, don't feel anything in the breast, that would make sense.